Millions of Americans struggle every year with chronic neck and back pain caused by common conditions like degenerative disc disease, bulging and herniated disc, and spinal stenosis. So this morning, we're going to hear firsthand how Dr. Miller's DRX program has helped thousands find relief after failed treatments. So we want to say good morning to Dr. Miller, along with his patient, Jessica. Good morning. Thank you so much for being here with us today.
Thanks, Leanne.
Sure. I just rattled off some pretty big words. If you kind of touch on exactly what those are and what people are feeling when they have those.
Sure, Leanne. And these are common terms for people that struggle with neck and back pain for months or even years. Common terms they hear from their doctors are things like you're struggling with degenerative disc disease. And so that's where this usually starts, the degenerative process of the spine with these degenerated discs. And what happens, Leanne, is these discs are like a wet sponge when they're healthy. They're thick, they give these nerves space, and they're very squishy and shock absorbing. But with stresses in our lives and neglect, the discs will start to degenerate, and basically they dry out, they start to thin down, and you can see here how this nerve is being pinched. The opening's very small, but also you can see how brittle and hard they are. So they're so rigid, it's very difficult to move around. Mm-hmm. They don't have that shock absorbing effect. And when that's not corrected or treated, it can lead to bigger problems like a bulging or a herniated disc, where these discs actually start pushing out. You can see here it's pushing right out into that nerve. That's a herniated disc. And these conditions, whether they're degenerative discs or bulging or herniated discs, lead to a condition called spinal stenosis, which is narrowing of the nerve opening. And when that nerve is, or the opening is narrowed, it pinches the nerve and causes that chronic neck or back pain. But at times it can also affect the extremities like the arms or the legs as well.
Goodness. So commonly, how do people go about getting this treated?
Well, a lot of doctors start by recommending different medications, and there's pain medications, muscle relaxants, anti-inflammatories, there's nerve drugs out there, or any combination of those, and it basically suppresses the symptoms. And when patients are struggling and that's not working, many times they might go to injections at pain clinics. They usually inject cortisone into where the nerve root is to chemically reduce inflammation, so hopefully the nerve isn't pinched so bad. Some pretty nasty side effects with cortisone that people should consider, but it's not fixing the problem, it's just chemically reducing inflammation.
Right.
And one of the last resorts, sometimes they burn the nerves, which is called a rhizotomy, to kill them off, so the patient can't sense pain there anymore, but they will regenerate and come back and then get pain again. And for many of the last resort would be neck or back surgery, which is very invasive. And a lot of that's cutting away bone to create more space for the nerves. Most of the time, those treatments are just treating the symptoms. They're not actually correcting this. And that's why these patients have to keep doing that over and over again, just to keep masking those symptoms to get by.
And that's the thing, it's just kind of a big Band-Aid for all this. And Jessica, I think this transitions nicely to you. What were you experiencing before you came to see Dr. Miller?
Basically, I was just trying to get through my work day. I was not happy, in a lot of pain, and I just couldn't wait for the work day to be done so I could go home, lay down, sleep. It just was nothing but constant negative thoughts.
Negative thoughts. And we're getting a look right here. I believe these are her x-rays. What was she experiencing, Dr. Miller? What did you find?
So she did have quite a bit of neck and shoulder pain and low back and hip pain. This was an x-ray we took of her neck, and that arrow is pointing to that circle, that darker gray opening there is the foramen of the nerves come out of her neck, and that was being stenosed or narrowed due to the degenerated discs. There's lines drawn, and you can see the disc space between and how narrowed those are. So when her discs in her neck dried up and thinned down, that started encroaching on the nerve and causing a lot of that neck pain. And then she also had an MRI that she had previously done with a different facility. And these arrows are showing in her lower back. Those are actually bulging discs pushing into the spinal cord and nerves, which led to quite a bit of low back pain. And you know, she can explain she's tried a lot of treatments and it just wasn't getting better.
Yeah, was there anything specific that brought this on, or just over time?
Just years and years over time, and then it slowly got worse and worse.
And were you kind of an athletic person your whole life?
Yeah,
And I
I've
mean,
done sports, you know, tried to be healthy, but just different movements and work at the computer at my desk. My
Posture.
Posture.
Yeah,
It's
I mean,
just-
and we're constantly on our phones. We're doing all
Yeah.
that stuff. I think you're a great example because this isn't something that happens to old people.
Right,
Right. You're a
right.
very young person,
Yep.
so this is great that you're here to talk about the relief that he was able to give you. What kind of treatment did you receive? And let's talk about where you were before and where you are now.
Yeah, so definitely I tried a lot of different things, you know, injections. I've had 3 rhizotomies, physical therapy, and just nothing was getting better. It might for like the day, but nothing long term. So I was just about out of options. I didn't know what else to do, but I had a coworker that came to Total Chiropractic and he really liked it, and I'm like, well, give that a shot. So it's been 5 weeks and I've felt better in the 5 weeks than I had in the 5 years of trying all those different things.
Wow. And the treatment was DRX?
That's correct, Leanne. So when Jessica came in, you know, we talked and consulted about what she'd been through and what her symptoms were, and we followed that up with an examination on her neck and lower back. We did take x-rays. We got her MRI in to look at those images to, you know, make an accurate diagnosis as far as what was causing her pain. And through that, I was able to determine she was a good candidate for our spinal decompression program. And so that's what we've done so far, working on her neck and then her lower back. It's a medical device that's non-invasive. It helps to regenerate the discs in the spine, as you see on this animation. It's just a very gentle stretch controlled by computers. It's usually very relaxing to patients, but it draws those herniations back in off of the nerves and starts to draw the moisture and nutrients back into the discs. So instead of you know, being down here, it starts moving the spine and the discs in that direction, and that's why Jessica's really finally getting that long-lasting relief, because we're getting her discs and her spine healthier, not just constantly trying to mask that pain anymore.
Well, I'm so glad that you're feeling better.
Thank
really.
you.
Okay. Oh, also, you have a new patient special for anybody that's watching right now, saying, you know what, I'm where Jessica's been. I am where Jessica has been. What can you do for them, Doc?
We do. Well, we just encourage them not to give up. You know, even though you may have not gotten the relief you're looking for, there are other options. If they call our office today for $49, we'll do a consultation and the examination on their spine and start determining if they're a candidate for this procedure too, where they can get out of pain once and for all.
And when you talk about your angel tree.
Sure, we like to give back to the community, so we're a Angel Tree site, and the promotion we have is if people, and you don't have to be a patient, but if you bring a gift in with a receipt, we'll match that receipt up to $100 in gift cards for services and treatments in our office.
Fantastic.
So by helping others, they can help themselves as well.
All right, and they're located right there on East Paris Avenue Southeast. Thank you so much for stopping by. I'm so glad that you're feeling better.
Thank you so much.
That's right. Give them a call. They are there. If they are not able to answer, just keep on calling. They're there to help. We'll be right back.